It is now my honor to introduce the Dean of Harvard Medical School, Dr. George Daley. After earning his bachelor's degree, magna cum laude, from Harvard in 1982, Daley went on to earn his PhD in biology at MIT. He received his MD from HMS, graduating in 1991 with the rare distinction of summa cum laude, an honor HMS has awarded only 18 times in the school's history. He then pursued clinical training in internal medicine at Mass General and was a clinical fellow at Brigham and Women's and Boston Children's Hospitals. After an active clinical practice in hematology oncology at Mass General and Boston Children's, he assumed his administrative role as the director of pediatric stem cell transplantation program at Dana-Farber Boston Children's, a post he held until assuming his current position as the Dean of the Faculty of Medicine. Dean Daley has served as a member of the HMS faculty since 1995, and in 2010, he became a full professor at Harvard Medical School. Dean Daley's research focuses on the mechanisms that underlie blood disorders and cancer. In past research, he demonstrated the central role of BCR-ABL oncoprotein in human chronic myelogenous leukemia, work that provided the critical target validation for the development of Gleevec, a highly effective therapy for cancer. It has been my pleasure to get to know him over the last 2 years, and it is my distinct privilege to welcome Dean Daley to the podium.
Thank you. Before I start my official remarks, I'd like to recognize the fact that the Harvard medical community has lost one of its legendary leaders. Dr. Irving London passed away yesterday afternoon at the age of 99. Dr. London was the founder of the Harvard-MIT Health Sciences and Technology Division. He was a distinguished scientist, a professor of biology at MIT, and a professor of medicine at Harvard Medical School. He taught the HST 140 molecular medicine course for much of the last 50 years, and was indeed teaching actively through last fall and was already planning the next semester's curriculum. I'm thankful that our community was privileged to celebrate him just a few short weeks ago with a joy-filled dinner at the Harvard Club. Dr. London leaves a profound legacy, and we will honor him with a suitable memorial in the months to come. Good afternoon. I'm thrilled to witness this gathering of family, of friends, of mentors. We are all here to celebrate you, the class of 2018. I want to address my comments directly to our exceptional HMS graduates. Today is the last day I stand in front of you as your dean, and the first day I stand with you as your fellow physician. And that makes me incredibly proud. It also makes me enormously helpful as well for our future. Throughout your careers as physicians, you will treat thousands of patients with conditions both rare and common. You will relieve suffering of many, but despite your most earnest efforts, some will die. Some of you will make life-saving discoveries. You'll develop new medicines for illnesses that are presently incurable. You will train the next generation of physicians. You'll direct research laboratories. You'll launch companies. You will employ your gifts to make others healthier and to make the world a more hospitable and healthier place. Today, you and your family are pondering the exciting opportunities you have rightfully earned as a graduate of Harvard Medical School. But I encourage you also to ponder this, an uncomfortable truth. American healthcare offers the triumphs of modern medicine to many, yet leaves millions wanting for even the most basic of care. Yesterday's news reported that 19 million Americans lack insurance coverage, and a significant number, but unknown, lack any access to meaningful health care. This is appalling. Consider this. What if you become a brilliant cardiac surgeon And yet you have to turn away an immigrant family whose cyanotic newborn infant has a surgically treatable heart malformation, but no legal status and no insurance coverage. Dr. Atul Gawande, who is one of our outstanding and eloquent faculty members, recently asked in a most compelling article in The New Yorker entitled, "Is Healthcare a Right?" What do you think? Is healthcare the inalienable human right asserted in the Declaration of Independence? One of those rights granted by our Creator, a right that our government is charged to protect? Is healthcare the means by which a just government ensures that its citizens will enjoy life, liberty, and the pursuit of happiness? Or has healthcare in the U.S. become a privilege, accessible only to those with the resources to afford it? As practicing physicians, healthcare providers, you will confront this question with disturbing regularity. This will no longer be a pathways discussion meant to provoke analysis and debate. This issue of healthcare as an inalienable right will acquire flesh and blood dimensions. It will have a name, an age, a medical record number, and a history that will include pain and disability. At first, these encounters will rattle you to the core. But gradually, and I warn you, you will be at risk of becoming desensitized. My advice to you, don't. You will be at risk of becoming comfortably numb to injustices you see in your practice, in healthcare generally, and around the world. But my advice to you is don't. You will be tempted to rationalize away inconvenient truths and reach for the safety blanket of moral relativism. My advice to you, don't. Health disparities, income inequality, bigotry, racism, discrimination, xenophobia. You will encounter these on your hospital rounds, in the operating room, in your labs, and throughout your community. These are maladies that ail modern society and modern medicine. And today, I implore you as new physicians to seek to cure these ills. As budding surgeons, to imagine excising them. Treating these ills requires no less urgency in your practices than pneumonia or cancer. As you go forth in your practices, I urge you to remember the core values of Harvard Medical School. These core values embody our reason for being as clinicians, as scientists, as citizens. Serving humanity, conducting yourselves with integrity and accountability, striving through lifelong learning for growth and excellence, embracing and championing diversity, practicing inclusiveness, not elitism. These are but a few of the core values that we have worked to instill in you at Harvard Medical School. So I urge you, remain vigilant about the biases that impede your patients' access to care, biases that will taint their outcomes. I urge you, respect and seek counsel from those who are different from you. Just as diversity propels biologic evolution, so it enriches us as clinicians, as scientists, and as people. I urge you, resist becoming numb to injustice. Confront inconvenient truths. Pay heed to painful feelings. So today I urge you, yes, use your talents to discover new treatments for Alzheimer's, for diabetes, for cancer. Use your formidable medical skills as well to diagnose and treat the darker pathologies, those insidious behaviors that drive wedges between races, ethnicities, and religions. These are ailments every bit as worthy of your incisive medical attention. Today, I urge you to diagnose and to treat them as well. Martin Luther King Jr. once said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." His words ring true today, more than a half century later. The inequalities he spoke of are today often more subtle, at times less obvious, yet they surround us and are insidious. I look at you with great hope. Perhaps one or more of you will pursue research that unravels the origins of these most virulent of pathologies, the pathologies that lead to health inequities. And it is my fervent hope that one or more of you will find the path towards cure. Quixotically naive, perhaps. But remember, achieving equality in healthcare is at the heart of fairness and social justice. In my mind, and I hope in yours, access to healthcare is an inalienable human right. So as newly minted Harvard Medical School physicians, as you advance our collective mission to alleviate human suffering, remember, this is the next frontier. This is the mission I call upon you, members of the class of 2018, to pursue. Congratulations, I applaud each and every one of you on this momentous achievement in your life. Thank you very much.